Hello everyone. In this video, we are going to study the exogenous pathogens. The exogenous pathogens refers to also called the six climatic pathogens. We also called six qi. So 6 refers to the number. So six different kinds of qi, which are wind, coldness, summer heat, dampness, dryness, and fire. So these are climatic factors in nature which corresponds to seasonal changes. In different seasons, different qi is dominant. And the 6 exogenous pathogens, or as you can see from the brackets, as writes there, 6 evils. 6 evils are the direct translation from Chinese, because in Mandarin, evils refers to something bad, something cause damages. That's evils. So the pathogens in Chinese medicine, traditionally, we call them evils. So what causes the pathogen? What causes the diseases? We said that it's the evils. What kind of evils? The evil of wind, the evil of coldness, the evil of summer heat, the evil of dampness, the evil of dryness, and the evil of fire. So that's the traditional translation of evils. Nowadays, most of us, we use the exogenous pathogens. But from here, also from the previous video, I told you that the 6 exogenous pathogens refers to the wind, the coldness, the summer heat, the dampness, the dryness, and fire. And also I have told you that the fire actually is similar to the heat, but fire is hotter than heat. Now here, if you're confused that from 6 qi, I said the 6 qi refers to these 6 climatic factors. The one says the 6 exogenous pathogens. I also say that these refers to the wind, coldness, summer heat, dampness, dryness, and fire. What's the difference between them? Between these two, 6 qi and 6 exogenous pathogens. Actually, the 6 qi is the normal climatic factors in nature. But when these 6 qi cause diseases, then the same stuff, we call them pathogens. So if the winds, for instance, the wind in winter or in spring, the climate is very windy, and then most of us still very healthy. So the wind here we call the 6 qi. But for a certain group of people, or for one of your friends, their body constitution is weaker. So in this climate changes, they become sick. And when we talk about the diseases on your friends or on the other patients, it says that they were attacked by the pathogen wind. You can see the differences from here. The 6 qi and the 6 pathogens, they are actually the same stuff, but only refers to different conditions. If the factors, climatic factors, did not cause diseases, then they are called 6 qi. If they cause diseases, then they become the 6 pathogens. And also when we mentioned about the body constitution is actually, in other words, we also use the healthy qi or your defensive qi. So that's different way to describe your protection of your body against the nature. So here, that's the definition between 6 qi and the 6 pathogens. The 6 qi, they corresponds to the seasonal changes. We see the abnormal 6 qi. The abnormal actually should add the quotation marks there. The reason why is the abnormal is relatively abnormal. It's not abnormal like technically. What does it mean by this word? These words sounds quite confused. And then it actually means that whether or not it's normal or abnormal only depends on whether this factors will cause diseases on individuals. If the person have very healthy or very strong body constitution, in very dramatic climate changes, is still healthy. For instance, the coronavirus is not suitable to use as an example here because that's epidemic diseases. Epidemic diseases we're going to introduce in our later videos from the pestilential qi. So the 6 climatic factors and the pestilential qi is quite a bit different, but you can use the common flu as an example. For instance, you and your friends and you in the same situation, you study in the same university, in the same classrooms, but one day your friend becomes sick, but you're still healthy. So when we're speaking of your friends, the climate now we call the pathogens, but the climate to you, we call them normal. But you see, 2 of you study at the same place, in the same classroom, in the same university. While the climate can be pathogens, it also can be the normal condition, the normal changes. That's because the definition only depends on whether or not they cause diseases or not. So that's the 6 exogenous pathogens. And also the 6 qi, as you can see from the definition, it corresponds to seasonal changes. So these changes can affect our health. In winter, it's supposed to be cold. In summer, it's supposed to be hot. But for some instance, all of a sudden in summer, there's hailstorm, and then the weather become very cold in the evening. And if you are strong enough, if your body constitutes it's good enough, you can adapt to these changes easily. But for some with very weak body constitution or some patients with very severe diseases, they might develop into even worse situation. That's because the climate changes, these climatic factors, dramatic changes, going to affect our health. These 6 exogenous pathogens. So in the season, the 4 seasons, when the climate changes gradually, we can adapt well. But once the changes beyond us ability to adapt, then you will become sick. And then in this condition, the abnormal changes of the climate. We call them exogenous pathogens. So from here, you can see that there are common features of the pathogens. Seasonality. The climate, the wind, the cold, the coldness, the fire, the dryness are closely related to seasonal changes. That's because in different seasons, we got different dominant weather. For instance, in summer, hot. In winter, it's cold. It's coldness, where coldness and fire come from. Also in autumn, it's dry. The dryness, where dryness comes from. So these are the seasonal changes, and they also related to the internal organs. That's from the 5 elements. You see different seasons relate to different elements, and different elements relate to different organs. That's why the pathogens are related to different organs. That's the formula we introduced in our 5 elements. A equals B, B equals C, then we can conclude that A equals C. So the pathogens related to the season related to the 5 elements. For instance, the wind. The wind is related to the spring. Spring is related to the wood in 5 elements. And in 5 elements, the liver is related to the wood. So in this formula, the wind is related to the liver. That's actually why in some conditions, for instance, someone got flu or pneumonia, sometimes apart from fever or headache, sometimes they will have vomiting, they will have diarrhea or distending abdomen. In this condition, why they have these symptoms? That's actually because they got the spleen deficiency. Why they have spleen deficiency? That's because of the liver attack the spleen. So that's in 5 elements. The liver overact on spleen to cause the spleen problem. But why in the flu patient or the pneumonia patient will have the liver problem? So that's because the liver is related to the wind, to the wood. The wood is related to the wind, and this patient was attacked by the wind. That's why they have this kind of symptoms. So these are exogenous pathogens. If you feel quite confused when I say these examples, you can write down the words actually, and you can see from the 5 elements, then you will understand better. The second feature of the pathogen is exogenous factors. The 6 climatic factors enters the body by the skin, the mouth, and nose. Invasion of the pathogenic factors results in the Actiris pattern. We're going to discuss these patterns in our diagnostic after the theories. So after the theories study, we almost finished the theories study. So just a few more lectures from here. And after the theory study, we go into the diagnostics. From the diagnostics, you will know what's the Actiris pattern. It refers to aversion to cold or superficial patterns, Actiris. So the exogenous pathogen always attack to the activities. They not 100%, but most of the condition. And the region or geography factors, environmental factors and region have the same effects on the body as any one of the climate factors. So it depends on where do you live. We have mentioned quite a few times that people live in Johannesburg and people live in Durban or in Cape Town. They are different. They also may suffer from different diseases due to the climate, due to the environmental factors, such as in Joburg, people may suffer from more lung problem, more dryness. If people from Durban, dampness there, people may suffer from arthritis more, or different kinds of joints pain. And the region also not only related to the environmentals, it also related to the job, the work they were doing. So for instance, someone they work under the ground, they work in the mine, or someone they like the fishermen, they stay in the coast, they stay in the water all the time. So the fishermen always are more likely to have joint pain because the coldness of the water can affect the body. So these are related to the region and also related to their occupations. So these actually because of the environments where they live or where they work they have easier or they have more exposure to those pathogens. Or someone they work in a food supermarket, especially for the raw food section, they always with air condition or with the fridge there. So in this environment, they always have coldness, and this coldness after a long time can affect the person, can cause different problems of them. They might cause the joint pain, which can be any kinds of arthritis, or for ladies, they can cause the cold condition of the person. They can have dysmenorrhea. They can have infertilities. So these are all related to the regions, the environmental factors, the coexistence. This refers to these 6 pathogens can affect the body individually or in combination. So each of the pathogen can affect, for instance, the wind, the coldness, or the fire. They can affect us individually, only the wind. So sometimes we only suffer from the wind, or sometimes we only suffer from the coldness. But more common condition, more common situation, that these factors always come together. Not all of them, but some of them. But sometimes we say that the wind cold or wind heat attack the body. So that's the features of these pathogens. They are more likely to happen together. In these features, some of them were revealed in 黄帝内经, our first classic. In 黄帝内经, it described as one of the big symptoms. Big symptoms. When we studied internal medicine, you will know that what's big symptoms. B syndrome is a kind of pain, a kind of joint pain, and then it described in 黄帝内经 that's what's the causes of B syndromes. B syndromes, BI syndromes. Described that B syndromes is due to the combination of the wind, coldness, and dampness. When these three pathogens combine together, it will cause B syndrome. That's also why in our treatments we use the herbal medicine or acupuncture or massage method to relieve wind or coldness or dampness to treat this kind of joint pain. So these four are the features of the 6 exogenous pathogen factors. Next, we are going to talk about the pathogens themselves. The first pathogen we're going to discuss is the wind. Firstly, from the picture on the right side, do you see the wind? The answer is no. Of us, we don't see the wind in the picture, right? Because we can't see the wind. But do you think there's wind in the picture? While the picture was taken, is there wind? And the answer is yes. The reason is because we see the branches, the leaves is waving towards one side, so we can assume that the wind was blowing from the left to right. So that's the phenomenon from the environment, something we don't see, but we can assume there is something there. This is very similar to the pathogens, the title of these pathogens we use. The wind. We don't see the wind in our body. That's why we use the wind as the name of this disease, as the pathogen. That's because these symptoms have similar characteristics of the wind in the environment. So firstly, let's see what's the definition of the wind. The wind refers to the factors that have the characteristics of dispersing and constant movement. So these characteristics are actually the characteristics of the wind in the environment. Can stop the wind? We can't. The reason is because once the wind stops, there's no wind, so you can't say that's the wind. If there's wind, the wind is keep moving. There's constant movement. So same as in our body, we have similar characteristics, and the wind is related to the wood from the 5 elements. And then the wood is related to spring. So the wind also related to spring is also the main pathogens in the spring. The characteristics of the wind. The first characteristic is the wind is a young pathogenic factor and easily attack the young parts of the body. So what's the young? Where is the young part of the body? Or where are the young parts of the body? The young parts of our body refers to the upper part of our body or at the back of our body, right? Compare with the upper part of the body and the lower part of the body. The upper part is considered as the young part. Compare with the abdomen and the back. The back is considered as the young part. That's why the wind is more likely or it's easier to attack the young parts of the body. Then the symptoms, when the wind attacks the young parts of the body, if the wind attacks the the head. We may feel headache. The yang parts of the body also can refer to the superficial part of the body. So compare with the superficial and internal. Internal is yin, superficial is yang. So the patient can have sweat from our skin, can feel aversion to wind, that's also from the skin. The sweat, that's because of the dispersing function of the wind. So the wind can cause the pores of our skin to open, to cause sweat. That's the yang pathogenic factor and attack the yang parts of the body. The wind begins abruptly and migrates to different parts of the body. This refers to the characteristic of the wind. The wind in the environment, it can blow here and there. The wind will never stop, and also you can't let the wind to blow to one direction. You can't control the wind in the environment, right? Same as in our body. Some symptoms have the characteristic of moving. For instance, some patients they feel the joints pain, the moving joints pains. What does it mean there? The patient will tell you that they feel the pain in the joints, such as the day they feel the pain in the right wrist, and the second day the pain can move to the left ankle. The third day, the pain can move to the left wrist, elbow. So these kinds of symptoms, these symptoms is something I make up here, but that's in clinic. The patient will tell you on the first day, the second day, the third day, they actually experiencing different area. They will tell you where it is. But these characteristics, moving, constant moving, why the joint pain will change to different area, why the patient may suffer from the pain in different joints within a few days or even in a few hours. Now, for this characteristics, we think that this characteristic is very similar to the characteristics of the wind migrates and abruptly migration. And we also, in the environments, because we don't see the wind, so we don't know where the wind happens. So that's also exactly the same as the pain in our body. We don't know where the pain going to move to for the next day. What we know now is yesterday where did I feel? Today where I feel? Tomorrow we don't know. The same characteristics, especially for the joint pains, and also the wind. The movement of the wind is very quick. That's also the similar characteristic of the symptoms, especially for the 6 exogenous factors, and such as patient attacked by the wind on the face. Sometimes the patient can have the facial disorder, such as the Bell's palsy. The Bell's palsy is the disorder of one side of one's face, and this situation, because it happens very quick, the patient also may have the experience of being blown by the wind for quite a long time before the Bell's palsy onset. So in this situation, we also think that the patient is attacked by the wind. The third characteristic, wind is characterized by the constant movements and quick changes Counter movements and quick changes. What kinds of movements, constant movements in our body? The joint pain we use as an example just now. That's migrates. The migrates is something move from one to the other. The previous one will disappear, and then it appeared in other area. So that migrates. Constant movements can be. So there's one symptom of constant movement, such as spasm. During the course of a spasm, that's the muscle trembling. That's constant movement of the muscle, right? And also the trembling of, such as patient with Parkinson. The Parkinson patient, their fingers keep trembling. And also for other, the trembling can be from other diseases, not only from Parkinson. Especially for senior patients, they also may have trembling. So these kinds of symptoms, because they move constantly, then we think that these symptoms are also due to the wind. That's because of the wind in the environment also moves constantly. You can't stop the wind. You can't control where the wind blows to, right? So for trembling, for spasm, we will use the treatments towards the wind. How to treat the wind, we're going to study in the materials medica and also the therapeutic of acupuncture in future. The quick changes also the characteristic of the wind. The quick changes in our body can happen. It can be seen that the symptoms change quite quickly, such as the such as such as a stroke. Stroke patient, they have the stroke happens immediately in very short time. That's the quick changes. That's why a stroke in Mandarin, when we translate directly, it means that attacked by the wind. So that's the wind. The last characteristic of wind. Wind is the leading cause of many diseases. Here, the leading cause refers to two aspects. The first aspect refers to that the wind can lead other pathogens. The pathogens we're going to introduce later, such as the coldness, the dampness, the summer heat, or dryness or heat. The wind can combine with those pathogens to attack our body. And the wind is always combined with others to attack our body. That's why we say the wind is the leading cause. So in our clinic diagnosis, we mostly use like wind heat, wind cold, or wind damp. These terms to describe the pathogens in the body, because most of the time it won't be the wind itself. When the wind attack our body, it always combine with others. So that's the leading cause. The meaning of leading cause. The second is the leading cause of many diseases refers to that the wind can cause many different kinds of diseases. Especially when we study the other pathogens, you will see that the other pathogens can cause more limited diseases because the wind can blow here and there in the environment. It can cause all kinds of damages by the wind. That's also why the winds in our body, it can go to anywhere. You can go to the head, you can go to your feet, you can go to different organs. into different areas, the wind will cause different diseases, different symptoms. No matter internal organs, external or superficial area, the upper part of your body or lower part of your body, the wind can travel to there, can cause problems. That's why we said the wind is the leading cause of many diseases. So if in a text, when the question asks us, what does it mean by the wind is the leading cause of many diseases? Then for the answer, you need to give me both of these two aspects. The first one is the wind can combine with the other pathogens. The wind can lead the other pathogens to attack our body. That's one aspect. The wind can lead the other pathogens to attack our body. The second is the wind can cause many different diseases. So that's the answer for this question. So here is a table of the nature and pathogenic characteristics of the wind. You can just go through them, and these are actually the symptoms and signs that we have introduced just now when we discussed the characteristics. So you can just go through them. And as you can see from here, when we study the wind, you will understand that we don't actually talk about the wind in the nature. We talk about the laws of the wind in the nature. Then we copy the characteristic, the laws of the wind. What characteristics of the wind has? Then we use this characteristic to apply in our human body. The reason why we use this title, we keep using this kind of a title, is actually because this title can help us to remember better, to memorize easier these characteristics, because this group of symptoms, the symptoms we see from the right side, this group of symptoms has a characteristic similar to wind. That's why we use this title. We also can change the title into different names, such as pathogen A or pathogen B. That's what the title of the diseases in general medicine, in Western medicine. How can they name a new disease? They either name from the virus, or they name after the first patient, or for the first practitioner who discovers the objects. So they name after them. But when you use this kind of title, these names, you don't understand what's in there, such as the COVID-19. The COVID-19 from the title, you will never know what's that. And then the COVID-19 coronavirus, they got different types. They got coronavirus A, coronavirus B, C, D, E. So they got different types. But from the title, you will know what's coronavirus A, what's B, what's the difference between them. From the title, you will never know. That's why we keep the title of the wind, the cold, because from the title you can understand better these symptoms, this group of symptoms, because this group of symptoms have the similar characteristics of wind. So when you see the wind, you can see the wind in the environment, what characteristics the wind has, and then you can copy to our body. That's the same as the other pathogens, such as coldness, dampness, that we're going to introduce one by one in the later videos. you will see that all these pathogens got similar characteristics to the objects we describe in nature. So for this study, don't have that kind of attitude when you hear the title of, especially for terms from Chinese medicine, because Chinese medicine matures 2,000 years ago. We will never use the modern terms to describe the etiology, right? But this won't affect our understanding towards the disease, because we base on the philosophy. Once we base on the philosophy, we more focus on the laws of the disease. That's also exactly why we can use Chinese herbal medicine to treat the COVID-19, even though we don't know what's COVID-19, even though we don't know the virus, but we know the law, the development principles of this kind of virus or this group of virus. That's how we treat them. That's how we're going to use these theories to apply into practice. You can imagine that 2,000 years ago, how do we know the flu, even the common cold? How did they know the flu? Or how did they know the heart attack? How did they treat these kinds of disease? There was flu at that time, 2,000 years ago. So in Chinese medicine and acupuncture, we more focus on the laws of the pathogens, the laws of the disease. We don't focus on the actual systems of these. Okay, so today we're going to stop here. That's the pathogen of wind. Thank you, guys.